This has been an amazing conference. This is our 7th annual conference. It's the first time we've done it here at Hopkins. It was a fantastic opportunity and a great experience here, working both on this beautiful campus and in partnership and in collaboration with Johns Hopkins and the Applied Physics Lab.
I'm delighted that Stewards of Change have chosen to partner with the university's Systems Institute to advance the national issue of interoperability across all health and human services.
I think one of the things that was really unique about this year was we expanded out again the circumference of who we're talking with. So we're reaching farther along the continuum of bringing in more and more organizations and administrations that are involved with touching children, families, and communities broader along the continuum.
The pathway to health information exchange is no longer about meaningful use or about electronic health records. It's about healthcare transformation. It's about ACOs. It's about care coordination.
It really is a unique opportunity to bring together people from a variety of backgrounds. The urgency around the healthcare delivery environment and the cost is driving a lot of inspirational and out-of-the-box thinking.
So I think this year people continue to see the interconnectivity between the various programs that they deliver touching the same clients, and they're seeing a broader range of services that can be coordinated. And so some of the work around system of systems that we talked about here was a really good example of human services and health not being alone in this world of trying to coordinate complex systems, but there are actually engineering methods and system methods that can help us think about the complexity of this world and put it into a form that we can really use going forward.
We can't do this work without, the innovators and the great thinkers in terms of developing the systems. And I appreciated the somewhat engineering focus to kind of see, what it looks like from a systems perspective.
Basically, systems engineering is a problem-solving methodology. Systems engineering really allows you not only to consider the things, but really get at the meat of the options to come up with, hopefully, what the optimal solution is, and that's really what we're all about.
Stewards of Change is doing a great job of bringing folks together so that there is a better understanding of the need for this technology and an understanding of the fact that a lot of this technology exists. I'm optimistic that the day will come when we'll actually have appropriate technology to help us provide the kind of service that we need to for the people in need that we serve.
Also this year we had more federal participation and their interest in this work. I think the idea of interoperability is cutting across various federal agencies now to the point where they're actually recognizing the importance of cross-cutting kinds of initiatives. And I think there's a growing recognition that the work collaboratively really can make a big difference and change across the country.
I remember when I first started in government that we had more questions than we had data. Now we're flooded in data.
One of our challenges, George talked about it, boy, we need to be able to share that data better.
The federal vision, right? The federal, when we were thinking about how does the eligibility process work for Medicaid and CHIP and the exchanges, we were thinking, one, as a client, as a consumer, I don't need to know what program I'm supposed to be in before I come in the door, right? I just come in the door and start applying. And two, that it's real time behind the scenes.
Over the next few years, Stewards of Change is committed to building a strong partnership with Johns Hopkins University. We want to bring new knowledge to the field and expand our capacity to drive change. And with Hopkins, they bring a tremendous amount of resources, subject matter expertise, a lot of depth of knowledge in areas. And I think what that does is it complements our ability to work with the organizations and the cultures and the conceptual architecture and complement with a technical and a subject matter expertise. We also want to leverage this unique moment in time to connect health with human services so we can build a truly holistic continuum of care. We are working to realize this vision every day and invite you to join us on this exciting journey.